Let's be honest, for any medical billing team, HIPAA can feel like a total minefield. It feels like one wrong step could lead to some pretty serious trouble. But what if you had a clear map? Well, in this explainer, we're going to build that map together. We're going to turn all those complex regulations into a practical, easy-to-follow framework that doesn't just protect your practice, but actually makes your whole operation stronger.
And this, right here, is the heart of the matter. Every single day, your team is handling what's called Protected Health Information, or PHI. We're talking everything from a patient's diagnosis code to their insurance details. You're basically the guardians of some of the most private, sensitive data a person has.
That really is the million-dollar question, isn't it? And having a solid answer, a documented, really well-thought-out plan, that's not just a nice-to-have. It is your first and best line of defense. So let's start building that plan. And we'll begin by understanding exactly what's at stake.
Okay, so before we start laying the bricks of what I like to call our compliance fortress, we really need to understand what we're protecting it from. And these risks, they aren't just theoretical. They can have a massive, real-world impact on your business, your reputation, and of course, your patients.
Let's start with the most obvious threat, the financial and legal penalties. And we're not talking about a simple slap on the wrist here. The fines for non-compliance can run into the millions of dollars. And a mandatory government audit, that can bring your entire operation to a grinding halt. This isn't just a line item on a budget. For some, it's a potential existential threat.
But beyond the money, there's a cost that can be even more damaging. A single data breach can completely shatter the trust you've worked so hard to build with your patients and providers. And once that trust is gone, wow, it is incredibly difficult and sometimes even impossible to ever get it back.
And finally, it hits you right where it hurts, your core function. See, secure, compliant workflows are, by their nature, efficient workflows. A breach or a compliance issue can lead to data loss and endless errors, which can grind your claims processing to a halt and disrupt the entire revenue cycle you work so hard to maintain.
So, how do we defend against all these risks? Well, the answer is a holistic, three-layered framework. I want you to think of it like you're building a fortress, a compliance fortress, with three distinct layers of protection all working together to keep you safe.
This table here, this is our blueprint. It lays out the roadmap perfectly. You can see the three layers of our defense. First, administrative. Think of these as your rules of engagement. Then, physical, which are literally the walls and guards of your fortress. And finally, technical, your digital locks and keys. Each one of these layers is absolutely critical for a complete defense.
All right, now for the fun part. Let's turn this concept into a practical blueprint. We're moving from the why to the how. We're going to lay out the actionable steps for building each and every layer of your compliance fortress.
We have to start with the foundation, and that's the administrative safeguards. These are your policies, your procedures, and all the people-focused rules that govern how your team operates and handles PHI every single day. Think of this as your command center.
So, what does this look like in practice? Well, it starts with a risk analysis to find your weak spots. It means training your team so everyone knows their role. Super important, it means giving people access only to the information they need to do their job, nothing more. And critically, you have to make sure every single vendor who touches your data signs a business associate agreement. That is completely non-negotiable.
Next up, we build the walls of our fortress. Physical safeguards are all about securing the actual, tangible environment where PHI lives. And that means everything from the office building itself down to the individual laptops your team uses every day.
This layer is all about tangible actions. We're talking about locking doors and filing cabinets, using privacy screens on monitors so wandering eyes can't see patient data. This is so key, especially in shared office spaces. It also means encrypting every single laptop and enforcing auto locks on workstations when they're inactive. These are simple steps, but together they form a really powerful barrier.
And a huge part of physical security is what happens at the end of a device's life. You can't just toss an old computer or a file cabinet in the trash. You have to identify everything that contains PHI, properly shred paper documents, and professionally, completely wipe all data from electronic devices before they ever leave your control.
Okay, and finally, we install the digital locks and keys. Technical safeguards are the technology and the protocols that you use to protect data within your computer systems. This is your digital frontline.
The name of the game here is control. Every user needs their own unique login, no sharing accounts. You have to enforce strong authentication, ideally multi-factor authentication. All of your PHI must be encrypted, both when it's just sitting on a server and when it's being sent somewhere. And your systems need to keep audit logs, so you have a clear record of who accessed what and when they did it.
And a really important part of your technical plan is knowing what to do when something goes wrong. A simple, written incident response plan is absolutely vital. Everyone on the team needs to know how to spot an incident, who to tell right away, and why it's so important to document everything. The time to make this plan is now, before you ever need it.
So, you've built your fortress. The job's done, right? Well, not quite. Building the framework is the first half of the battle. The second, and you could argue more important half, is maintaining it for the long term.
This slide highlights a really critical shift in mindset. A lot of teams view HIPAA compliance as a one-time project. You set it up and then forget about it. But the reality is, it's an ongoing process. It's about creating a true culture of security that adapts to new risks, not just checking a box one time.
So what does that commitment look like? It means scheduling regular internal audits. It means reviewing and updating your policies every single year at least. It means annual refresher training for your staff to keep security top of mind. And every single time you adopt new software or change a workflow, you have to go back and reevaluate your risks.
So we'll end with this thought. A strong HIPAA framework protects your patients, your partners, and your business. It turns a complex, scary regulation into a clear operational advantage. The real question I want to leave you with is this. Are the walls of your fortress strong enough, not just for the threats you face today, but for all the ones that are coming tomorrow?